All right. So good morning, good afternoon, and good evening to everybody. It's a good morning to our speakers and good afternoon here in San Francisco. And welcome to UCSF Center for Global Nursing Impact Series. This series aims to provide a platform for our nurses and global partners to share their remarkable work, offer valuable insights, and inspire our global community. Following the presentation, there will be a short Q&A, so feel free to write your questions throughout the presentation in the Q&A box. My name is Dr. Rebecca Silvers. I'm director of the UCSF Center for Global Nursing, and it is my pleasure, truest pleasure, to introduce this month's Global Nursing Impact Series speakers from Laos. We have Vandee Xiong and Noy Keopaseuth. Vandee is an innovative and patient-focused operating room manager, scrub nurse, and surgical first assist at Lao Friends Hospital for Children. He was among one of the first nurses to join the hospital when it opened in 2015 and has now dedicated more than 11 years of service. He previously, prior to the operating room, worked our inpatient, outpatient, and emergency room department before joining the OT in 2017, where he now leads the surgical team. His experience in suturing, wound care, sterilization, and scrub offering a variety of pediatric surgical procedures. His experience and longstanding commitment continue to strengthen the hospital's dedication to delivering safe, high-quality pediatric surgical care. We also have Noy, who's a nurse anesthetist at Lao Friends Hospital for Children. And like Vandee, he joined the hospital shortly after its opening and initially worked both inpatient and emergency department before his training in nursing anesthesia. He was part of the first cohort of nurses to receive the specialized training and come back to Lao Friends Hospital for Children. Noy has since hosted and collaborated with international volunteers and now serves as an educator for nursing students from both Laos and the United States when they come to rotate at Lao Friends Hospital for Children. His professional development has included travel to hospitals across Laos and abroad to further strengthen his anesthesia practice. We are really excited to feature both Vandee and Noy, who presented similar findings at the Global Initiative for Children's Surgery meeting in the Philippines in February 2024, and continue to highlight the powerful impact that nurses make in pediatric surgical care in Northern Laos. I have been a collaborator with these wonderful nurses for more than a decade, and it is just such an honor to see them share their remarkable work today. So welcome, Noy and Vandee, and I will hand it off to you. Anisha, next slide. Perfect.
Okay, everybody here. Good morning, everyone. My name is Vandee. Thank you for giving this opportunity to us to share about our hospital information. Okay, the next slide. So now I will take you go to Laos to see Laos. First, we'll talk about a little bit about the general information in Laos. Like Laos is the landlocked country. It's colorful of mountain and about 70% of mountain. For the population in 2026 is 7.8 million. And the median age is 24.9 years compared to US and Japan. The ethnic group is around 50 ethnic groups, but we divided only 3 big group like a Lao, Khmer, or Hmong. Yeah, but we count the small is about 50 ethnic group. Yeah. For the GDP per capita in 2024 is 2,124 US, compared to US is 70,248. For the poverty rate in 2023 is 16.8%. This is the general information in Laos. Next. Okay, so now we will talk about the history of the hospital, why we had the Lao Friends Hospital. So this is the history. In 1994, photographer Carol found a 7 years old girl died because her father don't have money to pay cost $2 for her medicine. So that is why he built 2 free hospital in South Asia, is friend without a border. So the first hospital in 1998 in Angkor Hospital for Children, Siem Reap, in Cambodia. Right now is the under local management. And the second hospital is in Laos, is my hospital in 2020, in 2015, Lao Friends Hospital for Children in Luo Prabang. Yeah, next. So now this is my hospital in Laos. This is the photo, yeah, Lao Friends Hospital for Children. It's on the ground of the provincial hospital, Luo Prabang, Lao PDR, many children in the north. Over 45,000 children since enrolled at the hospital, and over 300 patients since opening in 2015, and 13 department, 52 hospital beds, and 24 neonatal beds, and over 250 over 200 employees. We also had the outreach team to visit our patient because in Laos it's difficult to come, and we had an outreach team to visit them. Over 100,000 patients and travel over 45,000 kilometers. Next. Okay, so now I will take you to see the operating theater in Laos. So our operating theater is open in July of 2016, and the minor just opened in September of 23. We do 4 to 7 cases per day, not include the minor. So for the minor room, we just only do the small case like a burn or abscess or some tongue tie or wound injury. Yeah. And we also divided our team to do on call to do emergency case on the weekend or after working because we were only Monday to Friday. And we had only a small team. In our team, we have only 3 nurse anesthetists and 2 scrub nurses right now. And we don't have our own surgeon. We invite a surgeon from the provincial hospital to do our cases, and we pay them per cases. And but right now we also train our doctor to be the surgeon in Vientiane for 3 years. We have 3 doctors. So this year is the last year, and other doctor will finish and will come to do our surgeon. We are very happy to welcome back because we don't have surgeon. Next. So this is the OT managers and scrub nurse. What is the OT manager doing in here in Laos? We compare is how different. So the OT manager, they do like a scrub nurse, security, a surgeon assistant, managing or control all supplies or wound care, and doing simple cases with our surgeon, and communication to an other department like a doctor or surgeon or doctor and other department. Yeah. Next. For the indication for surgery at Lao Friends Hospital, we had our hospital, we do all many different type of surgery, like abdominal surgeon, orthopedic or craniotomy. Yes, for the abdominal, we do appendectomy or hernia hydrocele into subsection and gastroenterosis. So in Laos, it's very common to have the gastroenterosis. Since we opened our hospital, we have made more than 20 cases for the gastroenterosis. Yesterday, we still have one, too, and do the bladder stone or cell. EENT, we also do very common case like we remove ridge from the nose or trachea or twice. Yeah, for the ridge, it's very common to have in Laos because most of the children they drink the water in the river, and they catch the ridge from the river, and when they go to the nose and eating the blood for a few months, and the ridge is getting bigger and bigger and made the baby difficult breathing, and they come to the hospital, which is take out. So this is very common. And also for the orthopedic is very common in Laos is motorbike accident and fall down a tree. For the children, fall down a tree very common from the season, like for example, mango season, many children fracture because they cry up to get the fruit to eat and they fall down. And craniotomy we also do too. And wound care, a lot of burns in Laos. For the burn is from like a season as well. For the cold season, a lot of burn. We do osteomyelitis, abscess, wound injury, suturing. Yeah, we do some chest tube for uh, take out pus or pneumothorax or injury. Yeah, and also do some eye surgery too. Okay, next. And this is the column that we tell you about our hospital since we opened 2016 until right now 2026, and but we here 2025. So the first year that we opened our operating theater is just only little bit little cases like 274 cases, but each year is increased more and more. So the most cases here is 2019 is 100,000, 1,356. That is the most cases that is after the COVID-19, that COVID. So 2025 is 1,176. So this is little less. This is the to show you that our operating theater to approve the cases. So next. This only specific that show you about the cases. What is the case is the most like emergency case since we opened that is only 9% or orthopedic a lot and abdominal 18% and others is many 50%, 57%. Yeah. So this is the show you to see that. Okay. So next. Okay, this is the photo that we took from with the surgical team. We collaboration with the surgical team and other country like Korea or Singapore or Swiss, Israel. So for the Korea team, they came to do clip and parrot and they come twice a year. But right now they already stopped that because Dr. Ham is who are doing the credit approach. He's quite old, so he stopped that. And the Singapore team they come to do credit and parrot and also do contractor as well. And they come twice a year, so they still continue their plan to come, and they just finished, and they will come again. The next trip is in July. And the Swiss team, they come to twice a year as well. They come to do burn or contracture and also orthopedics, the very bad or fracture. Yeah. So in March, they will come again. And in Israel, they come to do eye surgery. So the end of the February here, and they will come back. So they also come twice a year. Those is the thank you for those people. They come to help our patient to get a better life. Next. Okay, so now I hand over to Mr. Noy to talk about anesthesia in Lao Friends Hospital for children. Thank you.
Okay, thank you, Wendy. Thank you. Hello. Hello, my name is Noy. I am a nurse anesthesia from Lao Friends Hospital for Children. And I am going to present about what we are what we are doing at the hospital. And here that's some of our main job to do. So most the patient we have at Lao Friends Hospital like orthopedic surgery. So that's why we are doing many blocks like original anesthesia with guidelines. We use ultrasound for the block, and for the general anesthesia we also do, but less than do the block. And neurology we also do spinal encoder. Yes. Okay. So as you know, as Vandee mentioned before, so at Lao Friends Hospital, we have only nurse anesthesia and experience. So we don't have anesthesiologists. We do everything by nurse anesthesias. And the program that we train from to be nurse anesthesia, we train for 3 years by Luang Prabang Department of Health. And also the organized by the International Federation in Nurse Anesthesia. And also coordinate by the volunteer, by the health volunteer overseas. And we always works with the student from US, like the main uh, nurse anesthesia from US from the Pittsburgh University, and they take road trade to work with us. Just next. So here is nurse anesthesia workforce in Laos. So this I try to update, but in Laos they still not update yet. So this is the last that we update for the anesthesia provider. So anesthesiologist that is like only 62, and nurse anesthesia for 6 months of training. So in Laos we have the short term for training to be nurse anesthesia or anesthesiologist assistant, and we have 2 years of training, and medical doctor or medical assistant for 2 or 3 months for trainings. Yeah. Next, please. Okay. For the technique ultrasound, so before we use the landmark for regional anesthesia, and that's quite work well, but now we use ultrasound guide for into our block, and that's more safety and more reliable block. Our block is nearly 100% of blocking of working. So some case like patient 13 years old, uh, just up to 10 years old. So some case we do block with our GA, and some case we do with sedation, and some case just local anesthesia. Then we do the operation. Yes. So yeah, anesthesia, just original anesthesia workshop. So we not only work at the OT, but we always educate to the another hospital allow from Laos, like we teach, we do the workshop for regional anesthesia. We got help from the student from Pittsburgh University from US, especially from Dr. Rick Hanger from Pittsburgh University. And we do the workshop for the residents from the Vientiane resident anesthesiologist. They for year 3, year for the last year of them study. And then we take 2 days for the workshop. We do lecture, we do ultrasound guide, we do fast scan. Yes. Next, please. Okay, that's all that we do at our FHC in Laos. Thank you.
Thank you so much, Noy and Vandy. I think it's amazing to have you here because usually we get to be together in person. Just good. We already have one question, but let me first start by saying how incredible it's been to be part of this hospital's growth over the years. Because when you think about the population in Laos, which is about 8 million and 30% are children, and what Vandy, you showed earlier is that there's only one other pediatric specialized hospital in the country. And so access to specialized pediatric care is very rare, and you guys are creating access in that map you showed, Vandy, of all the children in the north. So it's amazing that number one, the hospital is creating such an important access to care point for pediatric specialized care and goes into the community and does that. But not only that, but then we have the impact that your team is making as a team of nurses creating opportunities for surgery is pretty incredible because just with a nurse, and Vandee, you do a lot of different roles you talked about. You, in our country, in the US, we either scrub or we circulate or we manage, and you're doing all of those. So it's pretty amazing what you're doing. And then Noy's doing the anesthesia. And then you have visiting surgeons from the hospital attached next door, the provincial, that help manage the surgical care until Dr. V is fully trained. So it's really an amazing example of how nurses are creating access to surgical care. And it's so impressive to see the volume and what you guys are doing. And we all know that if you know Lao Friends Hospital for Children, you know that it was started independently, but it's in the process of transferring over to the ministry. And so it's really part of a sustainable pediatric system it's pretty incredible. So let me hand off to a question we have from somebody in the audience. Ty Lee, are you able to? I'll allow you to talk, I think. There you go. Please.
Hi, can you hear me?
Yeah,
Uh, okay, this question is going to be for Vadi. Is it okay if I speak his native language?
please. I was going to say thank you to the boys for speaking in English for us. Yes,
Yes,
please.
Vadi, nhớ trong quý I don't know if my camera is off or on, but
It's off.
uh,
Let me see if I can. I don't know if I can enable that, but keep going.
okay. Nhớ trong Vadi, quý mong thế, quý bỏ hạt thế có yên đó tốt thản á, chỉ có thể lý tốt sai có. Cú mỗi lo lu nông hạt thế có yên mong giờ, nhớ có họ lử đó họ lu họ mò có bù ba thầu bây giờ mong tua bù là bù trong xe hạt thì bỏ coi giờ mong thế ấyว่าหรือเราก็ขอในมั่ว contract ก็จะนั่งเสด็จเที่ยว so every country comes twice a year chỉ thức số lúc lì nếu mà thức số lúc thức số tu năm mỗi phần սեդեթ յետո լա those are my questions.
Will you translate for us, Ty?
Oh yeah, so I'm asking Wadi, that since he is a minority within a minority, and
Yeah.
being a Hmong there, working at the hospital as an OT nurse, how does that make other Hmong people feel when they come and see that he's also, one of them having the language, because not everybody speaks Laotian.
Mm-hmm.
How does that make the community feel? And then the second question is, from what I get is that the hospital or the clinic contract with other nations or countries that come twice a year. So because of that, do they have a country there every month of the year?
Thank you so much, Ty. Vandee, go for it.
Okay, so có em không thế? For the Hmong people, yeah, they feel very, very happy when they come to the hospital. They see like they had Hmong language. So most of the people from the countryside, they cannot speak Lao. Like I just mentioned that they had 3 hill tribe, Hmong, Lao, Kamu. So most of the people from the countryside, they see us that we are Hmong, and they speak Hmong to us, and we speak to them, we help them. Some people, they cry because they're happy that they see the Hmong people in the hospital and can help them because they cannot speak Lao. So this is very good that we can help the Hmong people. Yeah, and this is the first question. And for the next second question, that I still little bit confused, little bit like they can't twice to help us for twice a years, right? And what
Vandee, I think
is
he's
the
asking, is there somebody there all the time because you have multiple teams coming? Like, how do you manage the schedule? Is there somebody always visiting?
how we manage the schedule?
Yeah.
For example, we, we had outreach team, and the doctor asked, and we, we contact the patient will come different time. That is sometimes very difficult. For example, the end of the March or the end of the February we had eye surgery, and in March we had two surgical team, but we have to manage the patient and the schedule not come the same time, like burn and orthopedic. Yeah, so they will come same month, but two surgical team come from uh Swiss team. Yeah, this is very difficult sometimes for us, for the patient as well. And our hospital is the small. Sometimes it's very difficult for our patient to stay post surgery. So sometimes we still borrow the provincial bed to our hospital. So this is quite difficult, but we still keep doing because we want to help the children. Thank you.
Thank you for that.
Thank you so much, Vandee. Does anybody else have other questions? I'm happy to lead with my last one. If there's nothing else in the group, feel free to raise your hand. Yes, Jesse. Hold on. I have to give you permission. There you go. Please.
Hello.
Hi.
Thank you, Vandee and Noy. So terrific, all the work you're doing. I wanted to know sort of how it began for either one of you in terms of at the hospital and training in operating in the operating services. It sounds like this was it a interdisciplinary kind of team, like any surgeons or doctors saying, hey, we really have to start doing surgery here, like together, or was it nurses? Was it Ministry of Health? I mean, how did this get off the ground at the hospital for you?
Rebecca, you repeat the question again.
Yeah. So we've worked together for too long. So why did the OT start at Lao Friends Hospital? Was it the provincial hospital? Was it the ministry? Why? I remember when we broke the walls down, but why? Why did we start this OT? And how did you get training if you started not in OT?
Oh,
Does that make
why
sense?
we training
How did you get
for
training and why did we start
oh
OT? Why did we need OT?
okay, so I training in online
Hmm.
with and other uh in I already forget, but I trained in online for 6 months to
Mm.
be go to the OT theater. Yeah,
Mm.
before I just study nursing, but I trained for 6 months to be that. And the operating theater, why we had that, because the provincial hospital, they don't have the for the baby, so the baby just like under 15 years old and in the north here, and they don't have operating theater. So in all the north and sometimes in the Vientiane also they come to here, and that is why we made the operating theater to help the baby. Yeah, and the provincial hospital they only treating around adult, and they not very good experience about that. For example, anesthetists or they cannot do that. Yeah, that is the reason.
And I think it might be more complicated, but before we were doing surgeries, the provincial hospital was doing some surgeries, but maybe there wasn't the same training or comfort, and they were wanting our hospital to take that on. Noy, were you going to add to that?
Yes. So I training after I graduate nurse. So I work for a few years at Lao Friends Hospital for children, and then we discussed to open the operation theater, and I got training nurse to be nurse anesthesia from I got the support by HVO, Health Overseas Volunteer. So they sent me to train in Cambodia for 1 year, and then I come back to work with student from Pittsburgh University, from volunteer, from health overseas volunteer. And that's why we open the operation theater, right? So if we compare for adult and children for operation, so before we have only provincial hospital, they have operation theater, but they have a lot of the patient. And when the children have like fracture or need surgery, they have to wait for queue for long time. So that's why we have to open the operation theater to support the children care like surgery or emergency cares. If we wait only for the surgery from provincial hospital, so that's too long for them. And the main reason they're not comfortable to do pediatric surgery. So especially for nurse anesthesia, for anesthesiologists, they are mentioned that very hard to do the newborn baby, like only 1 kilograms or 2 kilograms, like when they mention a gastroschisis, they don't know how to do for the anesthesia. But when we open our theater, we do every case from newborn, from premature, complication case. Yes.
Yeah, again, I just want to say thank you to both of you for joining us in your very early morning at 7 a.m. in Lao, and also for presenting for us in English. I know it is not your first language, but you do an incredible job, and we are so grateful. And I just want to say just what remarkable work you guys are doing and how proud as from knowing you for 11 years, how proud I am of your leadership and all that you guys do to increase access to pediatric care through nursing, and especially in this case to surgical services. We also have a grant through the American Academy of Pediatrics where we're supporting the development of emergency services, and there's an incredible nursing leadership at this hospital, and it continues to inspire me and so many others. Anyone who meets you, all that you are doing is really, really remarkable. So thank you for joining our community today. For anybody that wants to learn more, please check out Friends Without a Border and Lao Friends Hospital for Children. They're really doing incredible work to create access to care for children in Northern Lao. And thank you both for joining us. Thank you, everyone, for joining and attending. We are grateful for our community gathering today and look forward to our Impact series next month.